super excited to introduce this group to Basalt. What we do is we automate these back office workflows for admissions teams so they don't have to search through the hundreds of pages to make a decision. So what we do is we review all the patient documents. We surface the information the admission teams needs to know to make faster and more confident decisions. We read all 300 pages of the patient document. We compare that against the admission criteria. We can do that for any and all facilities, even where there's variability on a per facility basis. We flag any red, yellow, or green criteria where that patient maybe doesn't meet the facility criteria. A great example is, let's take for long-term care facilities, if the patient actually meets more of a hospice designation or is on hemodynamic monitoring, or in the BH space, if a patient has continuous oxygen dependency, or if they have recent aggressive behavior. We surface and identify that information so your teams can run really quickly and make a determination very, very quickly. Super excited to show you a demo here, and let's get into it. All right, we're looking at Basalt here. I want you to step back for a minute. You are a medical assistant or an administrative coordinator or a clinical liaison, and you're reviewing patients who are coming in via your referral pipeline. On the left here, we have the patients that have come in for a referral. That is going to be either through fax, so through something like WriteFax, or you can add new referrals if you have those documents within your personal device, or if you get that from the EMR. And we can also integrate directly with the EMR to pull in those referrals. When you upload those documents, Basalt begins processing that patient information. And when we get a face sheet, something like this of Jane Smith, don't worry, this is all non-PHI. This is fake patient information. When you get unstructured documents like this via fax, it can be images or PDFs, it can be handwritten. We're extracting that information, and the first thing we're doing is running that so your team doesn't have to manually enter this information. And we give you the opportunity to review those documents, and if anything needs to change, you can quickly edit. No more reviewing the face sheet, manually entering all this information, including the referring, accepting facilities. We automatically extract that from the source document and begin the ingestion and processing for that patient. Now, here's where the magic begins. Let's go into clinical. So we've uploaded our documents. We can see those here in our Files tab here. It includes all the face sheet information, progress notes. We split these documents by type for your team, and we separate out the clinical and the administrative documents. Then when you're ready, you hit Generate Summary. You select the clinical documents that are appropriate for the patient. You can also upload new documents here to run that clinical summary. And what this is going to start doing is our models on the back end are going to read all those documents, convert them into a text that our models can understand, and then run that against the facility criteria for admissions. So you can go from receiving a fax to generating a summary to knowing whether that patient is a good fit for your facility. So let's look at that evidence. Today, we're looking at a behavioral health facility. But again, we can work with long-term care facilities, BH, rehab, and nursing homes. Okay, perfect. What we see here is we've run the patient, and we're flagging for this facility. We've been given, hey, these are the red, yellow, and green criteria. Red is criteria where, hey, this patient doesn't meet our facility's ability to deliver care for that patient. Yellow is, this is somewhat of a subjective decision, and we need to have a nurse-to-nurse review before we make a decision on admitting that patient. And likely is anything that meets the facility's criteria. And what we're doing here is really pulling out the information that is still clinically relevant for whomever is deciding to admit or will in the future treat that patient. So let's start with continuous oxygen dependency. What we've done here is we've highlighted this being an issue for this patient. We've provided a summary here, in this case, the SpO2 levels. We provide a summary of the citation of where we found that. Anytime we're making an inference about a patient, we also source and cite the original document where we received that from. So here you can see this patient has an SpO2 at 88%, and me as the clinical liaison can review and validate that information prior to me making an administrative decision. Here at Basalt, we do not make the admission decision. We still enable the clinicians to make that final call. Our job is to sort and cite the evidence to really speed up this process and leave the clinical determination to those who are most appropriate to do that, the nurse or the provider or the CEO of that facility. Next, we can see here this case has this patient has a catheter. Again, this exceeds the facility care ability. And then we can see things like recent aggressive behavior hitting a yellow. Recent aggressive behavior, that one's really interesting because you can really think of that as being, hey, what is recent aggressive behavior? Is that 3 weeks? Is it 2 weeks? Is it yesterday? And what are the additional details about that recent aggressive behavior? And so what we can do here is, again, pull that out. This is where a nurse is great in making that final decision to determine, hey, is this patient a good fit for our facility? A big part of what Basalt does as well is we monitor quality and accuracy. We take that really seriously. So if there's ever anything you disagree with within Basalt, here we can see you can always report that back. We immediately review this feedback. If there is any sort of issue, we add that into the improvement of our models and continue to improve those results. Now, a lot of this is based on sort of clinical reasoning that your teams may decide to update their own sort of facility or clinical criteria, and we can always share and report this back to you as our customer. Perfect. The next piece is if you use any clinical appropriateness to make your determinations, like an interqual, we can provide that information and run that against the patient data as well. So things like, does this patient have any rationale for respiratory complexity or medical complexity for infection? Again, we're searching the patient record, identifying, and you can see again the source documents here of where we found that information. Just another level of clinical appropriateness on top of your existing admission criteria. One thing that we find with our customers that's super helpful here is we are providing a consistent output that you can audit, that you can review, and provide citations such that any variability you have in a facility now goes away. And you can refer back if there's a disagreement of whether a patient is a good fit to review the actual documentation versus trying to find it and search it or have any disagreements within the organization. You can look at the actual source information and clinical appropriateness your organizations already are using. All right, the last piece is what we call the clinical summary, which is, hey, what is going on with this patient? Give me a summary, any primary diagnoses, any additional conditions. In the case for LTAC, for things like vent settings or patient airways, height or weight, anything I need to do to sort of just quickly review what's going on with that patient. In addition, we're also running the financial information about patients as well. What insurance they have, whether it's active or not. We support multiple insurances. So if you need to add an insurance for secondary or tertiary, you can add that for patients as well, and we'll run the status check. In addition, we are also about to release, which we're super excited about, is the ability to also pull down the payer requirements for a patient. So what we can do is understand for that patient and that insurer what for a pre-certification is required, what documents are needed, whether that's a primary diagnosis or whether they're medically stable. What we do is pull those payer requirements, and then we run that patient information against those requirements to determine, hey, are we missing any core clinical documentation that's going to support this referral or this admission? What that allows you to do is reduce denials, provide all the evidence a payer will need to support that patient. If there's any subsequent denials and you want to appeal, you have all that documentation to make your case. So super important for improving authorizations and appeals and making sure that you as the facility are able to admit patients who are appropriate and for patients to get the care that they need as quickly as possible. Perfect. One thing you'll see here as well is we have different statuses. So as a patient goes through the internal admissions process, things like, have we started the patient? Have we verified their benefits yet? Have we escalated to any sort of, potentially CEO of that facility or someone to a nurse-to-nurse review within the organization? Have we started auth or pre-admission? Essentially any status that the patient can be in. And what that helps with is, as we have our list of patients, anyone can see the status of the patient. So if you have liaisons in the field who are working with a discharging hospital, for example, they can tell you, hey, actually this patient has auth approved, we're good to go. Or if the CEO needs to review a patient, they can see that status. Getting people out of email and being able to review this is super important. And then the joy of admitting patients and getting that status that, hey, we're in a spot where we can take care of this patient. The other component is, this work oftentimes happens in the field, whether that's on your phone, which is checking the status, or on an iPad. And what we also allow is the ability to review these workflows on mobile. So if I reduce the size of my window here and I select Jane Smith or Michael Rodriguez here, I get access to all the patient's clinical information when I'm in the field. So if I need to know their summary or their red, yellow, green admissions criteria, I have full access to that information. And when we're done and ready to complete the review, we can always include a decision, whether that's accepting or rejecting the admission, any reason, and a note. This then gets sent directly to the EMR for the next process related to bed selection and occupancy.